Wilta and I'm Fscj student, term 2. And today I will be demonstrating a primary and secondary administering medication. And I have checked the doctor's order. The doctor ordered 250 ml of normal saline for 4 hours. So I calculate my drop to be 10 drops per minute, and it's for fluid replacement and maintenance. And also the doctor ordered a 1 ml of Flagyl. I will add that to 50 ml of normal saline to run for 1 hour. And I calculate my drop to be 8 drops per minute. I also check my patient allergy. The patient does not have any allergies. So I also check my drugs, and I have generic name metronidazole. The trade name is Flagyl. The class is an anti-infective, anti-protozoal, anti-ulcer agent. The dose range, initial dose 50 milligram per kilogram, then 7.5 milligram per kilogram for 6 to 8 hours. Don't exceed 4 grams a day. My nursing intervention: assess for infection, vital signs, wound appearance, sputum, urine, WBC throughout the therapy. Monitor neurological status during and after IV infusion, numbness, weakness, and seizures. Assess for rash periodically during therapy. Steven Johnson, DC if severe, with fever, muscle joint aches. Check patient lime, liver enzyme. May cause dizziness, lightheadedness. Avoid driving or other activity that require alertness. Instruct patient to notify healthcare provider promptly if rash occur. May cause urine to turn dark. And watch for symptoms of superinfection, such as loose foul smell stool, overgrowth on the tongue, vaginal itching, or discharge. So I already labeled my normal saline. My patient is getting normal saline at 250 ml to run over 4 hours. I have my date and time, patient name, room number, and starting date, my flow rate, and my initial. And I have my Flagyl. My bottle is within date. The expired date is 12/15. And also I have my 50 ml of normal saline to mix with mine. To mix in my 1 ml of Flagyl. And I have the medication, the drug name, the dosage, date and time, patient name, room number, my start date, time, and the flow rate. So now that I already checked my order, checked my patient allergies, I'm going to my patient room.
Come in.
Hello, my name is Wilta. I'm an Fscj student, and the doctor has ordered for you to get the normal saline for fluid replacement, and also your Flagyl is now ordered, so we're gonna give you that as well, and that's for your skin infection. So can you tell me your name and your date of birth?
Joan Williams.
Your date of birth, Mr. John?
10/11.
Okay. Do you have any allergies?
No.
Okay. So I'm gonna wash my hands. I'm gonna put on my gloves. Checking my patient IV side. There is no swelling, no redness, no leakage. It's not cool or pale. So there is no sign of infiltration or phlebitis. So now I'm gonna go ahead and start priming my line for my normal ceiling. I'm priming my line for my normal ceiling. I make sure there is no air to my line. And I'm gonna clamp now and leave it there. Now I'm gonna clean my ivy site. I'm gonna aspirate for blood return. Blood and flush. And connect. So my patient will be getting 10 drops per minute. I calculate my drop and put in my drop per minute. So now I'm gonna unclamp all my lines and all done for now. So now I'm gonna clean. I will be hanging my flagell, the Dr. Otto 1 ml. I have my 50 ml of normal saline. I'm not gonna recap. I'm gonna draw 1 ml of air. And clean my bottles with alcohol. Okay, 1 ml of flagell. I clean my port and put it in. I will put my needle in the sharp container. So I mix my medicine. And prime my lung. I already put the date and time, the dose of the medicine, the patient name and phone number. And I will be adding 8 drops per minute. I will unclamp. And now that I'm done, I will lower. I will lower my primary bag. And everything is running, looking good. Mr. Jones, is there anything I can do for you?
No.
Okay. Now your IV is running. I will be back in 10 to 15 minutes to check on you, make sure everything goes well. You don't have any adverse reaction. And I'm gonna give you your belongings, lower the bed. And by the way, while I was flushing, I will use the push tab method while flushing my lung. So everything is running now. You have your normal saline and you have your flagyl. I will be back to check on you. I give you your belongings, your call lights. If you need me, call me. So I will go back to the nursing station. I will take off my glove first, wash my hands, and I will go back, document in the wire. I will record the time, date, the drug, the dosage, the route, this the condition of the IV site, and also I will record the volume of fluid that needs to be delivered, and I will say how is the patient tolerated everything, and I think that's it.